I am Dr. Simran, your host, and I welcome you all to a captivating exploration of role of Gen AI in infertility management and pregnancy care. Today we embark on a journey into the future of reproductive health, where artificial intelligence revolutionizes IVF success rates by 30% and achieving an impressive 90% accuracy in genetic screening for personalized treatments. Joining us is Dr. Sudip Chowdhary, the visionary behind India's first AI driven infertility ecosystem at Newbies. With over 9 years of experience in clinical leadership and recognized with Edward Jenner Award, Dr. Chowdhary brings deep insights into how AI is redefining patient care and driving innovations in healthcare. Welcome, Dr. Chowdhary.
Hi Simran, thank you for bringing me in.
To start, Dr. Chowdhary, could you please share a specific moment or experience that highlighted the potential of AI in transforming reproductive health for you?
So I think Simran, very good question. So artificial intelligence is actually revolutionizing the field of reproductive health, mainly by introducing sophisticated technologies that enhances not only diagnosis and treatment, but also patient care. So as the prevalence of infertility, as the recent WHO report of 2023, it is around 18 to 20% now across the globe. So AI offers innovative solutions to improve the chances of successful conception and healthy pregnancies. By leveraging this vast amount of data which we have in the AI systems and advanced algorithms, AI enables more precise and personalized approaches to reproductive health, which benefits both patients and healthcare professionals. So this is the very important point which we want to say. So not only patients but also healthcare professionals are hugely benefited by this.
That's great. Moving ahead, let's start with basics. How is AI currently integrated into infertility treatment and pregnancy care?
Okay. We divided into four main structures. So first part is diagnosis and treatment, personalization. So it's very important for every woman or a man to get personalized treatment for especially infertility because there's something very personal, right? So how does AI help? It helps with predictive analysis. Predictive analysis means AI algorithms will analyze the patient data, example like age, hormonal balance, lifestyle factors, to predict the likelihood of successful conception and personalized treatment plans. So at Newbies, we have developed a very structured approach, which we call a conception score, which takes into account 6 or 7 factors around the person's life and actually makes it an objective score, which is very dynamic, and it helps the person to understand what are the chances of conception. So this takes into account metabolic health, this takes into account age, hormonal factors, everything together. Second thing which is very important is image analysis. What it does is AI enhances the accuracy of medical techniques like ultrasound or MRI to detect reproductive health issues like a PCOD or endometriosis. So it through imaging study, it finds out the exact problem. Then in IVF, through embryo selection, AI plays a very important role where AI will analyze images of embryos to predict which ones have the highest chance of getting fertilized and implanted and developed. So, making the job of the obstetrician or the infertility specialist very easy. Next is monitors. So AI systems monitors embryo development in real time, providing insights into the growth, patterns and potential problems. Okay. Third, in ovulation and fertility tracking. So as we are doing, so a lot of wearable devices and apps through AI-powered algorithms can be integrated with the woman or the man, which gives you valuable insight like basal body temperature, ovulation cycles, menstrual phases, your other physiological factors to optimize the timing for conception. Again, AI integrates all this data from various sources to give you comprehensive information. Lastly, most importantly, genetic analysis. You'll be surprised to know that pre-implantation genetic testing, AI is helping that by analyzing the genetic information from embryos to identify potential genetic disorders, ensuring healthier pregnancy. So that's very important. So mainly 4 integrations, you can say.
That was really insightful and a lot more to know about AI because AI, when integrated with the expertise, becomes a different channel, I should say, for diagnosing as well as for giving better treatment outcomes. And moving on to the revolutionization, these fields by enhancing IVF success rates, it is definitely helping. So, what are the key advancements in AI have had the most impact on reproductive health?
So I think first thing would be machine learning algorithms. So what it happens is advanced algorithms improve the accuracy of diagnosing reproductive problems, also predicting treatment outcomes as we talked about. Next is NLP, or natural language processing as we call it. So NLP is something through which AI understands human language. Okay, so NLP enables the AI to understand and analyze the patient histories and other problems like medical problems, hormonal issues, and everything, and it aids in more natural diagnosis, just like a normal doctor would do, but without the other itsy bitsies of the doctors, right? Thirdly, I will say AI in genomics, as I talked about. AI accelerates the analysis of genetic data, identifying potential genomic disorders, and actually telling you beforehand that this could be a problem. And lastly, a lot of robotics is happening, mainly through surgeries and everything. And also AI does a lot of that thing in the robotics field as well. So yeah, so these are the four main key advancements which AI has as per as the reproductive health is concerned.
So, moving to the benefits and challenges, what are the primary benefits of using AI in diagnosing and treating infertility?
So I think, see, as I also discussed last time, that basically, again, there can be four benefits. First, you can say enhanced diagnostic accuracy. So we are all working in the field of medicine for better diagnostics, right? But human brain has its own limitations. What AI does is, through millions of data points, it improves the accuracy and speed of diagnosing infertility, mainly the causes, which leads to more effective treatment plans. So I'll tell you an example. So we had a patient around 3 months ago who came from 3 or 4 hospitals, all good IVF centers, and she was having recurrent abortions despite going through successful cycles. And actually, nothing was being diagnosed clearly what was happening. She went to millions of ultrasounds and everything. When she came into the system, the first things first, when we go through a questionnaire of information taking, and then an algorithm finds out what is issue, what is the wrong issue. We found out that there was an undiagnosed thyroid issue, which was not diagnosed, which is very strange because generally this is part of the normal onboarding protocols of every hospital. But funnily, it was not diagnosed, or rather, it was not diagnosed correctly. So once this thyroid disorder was cleared, this woman went through a successful pregnancy, and now she is currently on almost, I think, fourth month, fifth month of the pregnancy, and she's running it well. So important thing is enhanced diagnostic accuracy is very important. Then you get a personalized treatment plans. Like as with newbies, every woman or man who gets into the system, the AI algorithm understands that what this woman or man wants, likes or dislikes, and actually better than a human, it actually personalizes a treatment plan for you. Even the dietic plan, it understands what exact diet you like. So if you like, say, a South Indian diet, it will try and give you a South Indian diet and try and integrate your fertility things in your South Indian diet. So second thing, as I said, was more personalized approach. Third is it increases IVF success rate. So this has been proven multiple times by selecting the best embryos and monitoring developments more closely. The chance of IVF gets very high. Okay, and lastly, most importantly, patient experience gets very much better, because you get a personalized approach. Then continuous support is there, information is there, guidance is there, knowledge is there. So this reduces the stress. A lot of psychology help comes through. Totally, the patient experience becomes much better. So yeah, these four things I think is very important.
So, you are basically targeting towards a holistic approach with the
Absolutely,
help of
because
AI.
I think holistic approach is the approach in the 21st century medicine, isn't it? It is
Yes,
not one thing but five things which make your life.
absolutely correct. So, moving ahead, are there challenges or limitations in relying on AI for reproductive health decisions?
I think AI, reproductive health, like any other health issue, I think biggest challenge which lies for us is data privacy and security. So there are a lot of hackers around there. We don't want your patient's data to be leaked outside, right? So our systems have to be extremely robust from the cybersecurity point of view, and we take patient data very seriously, confidentially, very seriously. So handling such sensitive reproductive health information, I think, is the first and foremost importance for us. This is one of the biggest challenges, but then we are good at that challenge. Second thing is bias and fairness. So that's a lot problems is happening, because see, AI runs on data, so it depends on data which is collected. So if you have data mainly for Western countries and you try to extrapolate that in the Indian subcontinent, you may have a bias. So the data has to be universal data. But the problem is that majority of the studies or major data which we see is not from African subcontinent, is not from LATAM, is mainly from North America, Europe, and now we are starting in India. So that's a big issue because you have a lot of biases there. Third is regulatory and ethical considerations. So when you say regulatory means, so AI systems in healthcare, particularly sensitive areas like reproductive health, requires actually some amount of ethical regulatory compliance, mainly from the government side, and which also is required. In India, sadly, we don't have much regulatory now, but I'm sure things will crop up in the future. Regulatory clearances will be very important. Then you have to integrate with clinical practice. So this is one of the challenges we face when we tell doctors now that you have this system which can actually help you in getting better outcomes. So out of four, probably two say okay, we are good with it. One says we can try, and fourth says no, I'm good with what I'm doing. I think it's all about practice. Similarly, as mobile phone integration happened around 10 years ago, this is also going to happen, but it's going to happen at a much faster pace, which I feel. And again, as I said, dependence on data quality. The in AI is very simple. What you give in, you get out. So if you give good quality data, you get good outcomes. If you get bad quality data, you get bad outcomes. So yeah, so this four or five, I think, are important challenges and limitations.
So let's explore AI's role in personalized care. How does
Yeah.
AI enable personalized treatment plans for infertility patients?
Okay, so I think personalized treatment plan is the most important or the most biggest hallmark of AI based thing. So see, what does a woman or a man want who has infertility as a problem? They want a good holistic treatment which is going to give them a good end result, that they want to have a baby, right? You cannot have a single size fits all program for infertility or fertility management. So what AI does is through million data points. So you're also one of the data. So if you are one of the patients, you're also one of the data points. What it does, it takes you into account through those millions of data points and tries and compares you with those other million data points it has. And because it has information on all the data outcomes, it can give you a far more personalized approach than even your doctor probably can't give. Because I'm myself a doctor, I have seen probably 10,000, 200,000 patients, but the AI has data of 2 million patients. So it can compare those data real time and can give you much more personalized solutions, and also probably give you right factual information, which always we don't have in our control. So I think for the biggest part of AI is giving a personalized treatment plan, personalized psychological solutions, personalized diet solutions, which is very difficult for otherwise to give. But still, having said all those things, I feel that the only place where AI lacks is that human touch. So what happens is, I know we are making AI really human now through NLP and everything. But at some point, you really want to talk to that human being and say, no, yeah, Simran, I'm not happy with this diet. मुझे और कुछ खिला दो, मुझे और कुछ पसंद कर दो. But you can tell that to AI also. He or she will really give you good options. But that's the only problem where AI misses, that it doesn't have that human being. We are trying to build such human beings. So for us, it is a bee. It's a very novel concept that bee is someone who enhances fertility, who, because a bee does pollination in the nature, if you remember. So our bee also does pollination. It helps in fertilization. So our bee is the AI tool who gives you the diet, psychology, and all those things. But I have seen patients tell the bee that, I guess you're a human. So
So
yeah,
that's
that's
actually the feedbacks which are making you even more better and helping you to give a more human touch when compared to
yes,
a machinery thing. So
absolutely.
that's absolutely wonderful listening to such new approaches wherein patients are going to get 100% outcomes, because obviously if the patient is psychologically satisfied, you will end up having a good treatment outcome. So
Yes, yes,
that's really brilliant. Listening to all of these things gives a relaxation to the mind that yes, something is happening, and it's happening for good.
yes.
So moving ahead, can you give some examples of AI optimizing fertility treatments based on patient data?
Yeah, so lots of them examples. Lots of them are, I can tell you patient data, but then they're confidential data, so we have to change informations. So, see, in newbies, what we have done is something very innovative. So, there were a lot of AI based tools, like there were OVM, there was Flow, They mainly work on ovulation, they work on the BBTs, they work on the right time for fertilization, optimization, all those things. What we did with newbies is different. So we have those tools as well, but besides that, what we thought about is having an integrated nutrition, psychology, medical, and your fertility programs together. So we found that a lot of human beings have metabolic health concerns like type 2 diabetes, hypertension, hyperlipidemia, PCOD, endometriosis, all of these things hamper fertility. So there is no point of beating around the bush and saying that I want to go and look at your ovulation cycle when actually you have an erroneous cycle because you have PCOD. So why don't you treat PCOD? So best thing for newbies is integrates all those four things. So you have windows for, yeah, so when you come into the application, you'll be onboarded. You will automatically tell the machine that I have PCOD. I've been diagnosed with endometriosis. And so what the machine does is it gives you diet or psychological insights based on your condition. So it is completely personalized from that aspect. If you have a higher BMI, or we say a waist hip ratio these days more, so then automatically the machine understands that you have PCOD, you have increased waist hip ratio. So probably you'll benefit from losing weight. So what it does, it gives you a diet which is based on losing a bit of your weight. Also gives you certain goals for that. That how can you lose weight and how is it helping in your fertility? As I said, that we have this novel proprietary concept called as conception score. It takes into score 6 or 7 parameters and then gives you a dynamic score every week or every 14 days, which tells you that how are you faring as per as the conception is considered. So it gives you on 4 colors. So one is red, one is orange, one is yellow, one is green. Green or yellow being the better ones, orange and red being the not good ones. Psychologically, what we have done is when we talk to women, found the majority of the women didn't want psychological insights because they never felt that in India there's a lot of stigma with psychology. They think that going to psychologist means that I'm getting mad, which is wrong. So we found that the best thing for a woman or man to do is be in a secluded spot and talk to themselves. So we developed this proprietary tool of talking to the camera. So you just switch on your camera, you talk to the camera for 3 minutes, and through your facial analysis, through your sentiment analysis, through your voice, through your words, the AI system understands what mood you are in and tells you exactly what psychological intervention you want. So you don't need to go to a psychologist. So if the AI understands through your facial muscles that you are stressed out, you have said words like, I don't know what is going to happen to me today, or I don't know how long this cycle is going to continue, I'm worried. Certain keywords you tell, then the AI machine understands that what exactly is going through your mind and tells you better options from that. That you want to get some relaxation techniques, you want to breathe in and out. And obviously, it also refers you to a clinical psychologist. If you want, you can talk to a psychologist. But then, if you don't want to, you still have the option of getting to the normal mindfulness options. So this is completely taken away that thing of I'm not diagnosed. You will be diagnosed if you want to be diagnosed. You don't have to go to a human being to get diagnosed. The AI can diagnose you. It can do that bit for you. And the best thing is the psychologists are very happy with this because when they get a report from the AI machine, it has everything written in it. That say this woman, I'll take a name, say Anamika had these
XYZ,
issues.
yeah.
Yeah, Anamika has these issues. She said all these words, and we felt that she was anxious. We referred you to her. It's just like a junior doctor or a doctor doing the job. And referring to a psychologist. And actually, psychologist doesn't have to take so much of history because she already is aware that she has metabolic issues, she has this, she went through these infertility cycles. So a lot of thing has been done and dusted. So that's a huge, huge help for the psychologist as well. So win-win on both sides.
So basically, treating the underlying cause is the main agenda here that is being done by collaborating with AI in a better way, and that is like a boon for all the doctors out there so that they can diagnose us better and
Yes.
definitely get better outcomes. So
Yes.
before we move to the rapid fire round, can you share what inspired you to actually adopt an AI driven approach in infertility management?
Yes, see, it is a very interesting question because when I returned from UK in 2020, I think I could find that not only in the West, but in India also, there was a huge gaps in the healthcare sector. And majority of that was because of lack of knowledge. So See, I as a doctor always believe that the patient should know. So I'm not one of those doctors who feel that if you know, if you Googled it, you're wrong. I believe and I tell my patients to Google things. But yeah, important is to get the right information. Majority what happens is in Google or something, you may end up with the wrong information and then you are in a complete trap. So I still remember a patient who had come to me, a mother of a child of 2 years, who had this headache. This child was complaining of some headache. So generally, a 2-year-old child doesn't complain of headache, but anyway, I will tell you the story later. But then the mother was worried that this child had brain tumor. I said, "Why are you worried about brain tumor?" She said, "Well, I googled and I found out the leading cause of headache in children is brain tumor." Well, after taking history, we found out that the granny has headache and she complains of headache, and this child has heard the granny. And whenever this child wanted some attention, she used to go to the mother and say, "I have a headache." And see, that's how Google lands you in trouble. There's nothing wrong about Google, but the way it is programmed, the algorithm is programmed. So we wanted to have an AI model which will have validated medical information. So what we did is, our information, why is it different from any other co-pilot? So the medical information which we have given to newbies is based on 20 experienced professionals, all infertility specialists across India and the world. They have given validated information to be fed into the machine. So all the data which this AI copilot of ours has is all validated information. There is nothing kacha, no, nothing Wikipedia like. So all information is validated information which is there in the system. And obviously, because of that, you don't get wrong information, you don't get confabulations. So that is the reason which motivated me to do the AI thingy, because I wanted to give them the right information in the right time. So yeah, that is probably the reason why we did it.
You are sensitizing the patients as well as improving healthcare outcomes, as well as you are becoming a pioneer for all the doctors across the globe by adopting AI driven technologies and doing better for the community. So moving on to the rapid fire round.
Yes.
So what's your favorite tech tool in your clinic?
In my clinic,
Yeah.
my favorite tech tool is my laptop. If you can say that, my laptop, and I love my chat GPTs. And yeah, so these two mainly.
That's nice. So, most exciting recent medical discovery you have come across?
I think the most exciting recent medical discovery is when we tried to do a predictive analysis of ovulation in for twins. So what happened is, generally it happened around 3 months ago. When you do IVF procedures, it is difficult to find out that if you are giving rise to twins or triplets. But then the predictive analysis from AI algorithms can now predict it in accuracy in 2 to 3 days whether your zygote is going to have 3 divisions or 2 divisions. And I think that was amazing, because it's, I think, one of the best things, because you are very well prepared that what you are going for. So I'll say that.
The toughest diagnosis you have cracked?
Toughest diagnosis, difficult question. So I think every diagnosis is tough. If you are right, it is easy. If you are wrong, it is tough, always. But I think my toughest diagnosis, the most difficult diagnosis, when we landed up with a child who was 4 years old, who had a complex tumor of the abdomen, neuroblastoma. It was a very sad diagnosis, but then it did hit us very early. Because it was treated early, so the child had a better life outcome. That was one of the tough diagnoses, and also one of the bad ones, which we really don't want to have.
And one piece of advice for all the doctors across the globe?
I think the biggest advice I have for doctors around the globe is to keep learning, because learning cycles are something that always help us to grow, to evolve. Always be with the technology, current technology, and try to improve the technologies, because things which were done like 20 years ago or 10 years ago, this is not the way things will be done today or tomorrow. I always tell my daughter as well that what you're reading today may be completely irrelevant tomorrow, because I don't think it will help by knowing that which the first battle of Panipat was won by whom after 5 years, because ChatGPT knows all those things. You need to have more skills. So I think skills is more important than education. I think the same applies for doctors as well. Go on applying your skills, go on applying technology, give people a better life. Yeah.
That was wonderful. And that really helps because learning never stops. And as you mentioned, it's the era of evolution and it keeps on happening every day. So we need to continue that. So before we
Yes.
conclude, I would love to hear your thoughts on the MedSynapse platform. How has your experience been, and do you see it benefiting the medical community?
I think MedSynapse, the word, the entire name is very interesting because synapse means joining and medical, obviously medical. So I think MedSynapse is a good platform through which multiple doctors, professionals, even non-doctors can connect to each other and enhance their knowledge, enhance the information database. And I think MedSynapse is making a wonderful effort by connecting people, letting people know each other, talk about each other. Yeah, I think it's a very novel thing to do. Well done, you guys.
Thank you. As we conclude, remember that AI continues to evolve, promising even greater advancements in infertility management and pregnancy care. So that was really an insightful and I should say transformative impact of AI and reproductive health that we have come to know from you, Dr. Chaudhary. In our next episode with Dr. Sudip, we will explore how AI collaborates with clinical expertise. Till then, to our listeners, thank you for tuning into MedSynapse. And if you are a healthcare professional who would like to voice your insights on our platform, please contact us. Together, we can continue to drive meaningful discussions and advancements in healthcare. Thank you for joining us on MedSynapse. Stay tuned for more discussions on advancing healthcare innovations. Until next time, take care.